introduction. All right. Hey, we are live. How about that? Let me
There we
add our little
go.
banner. Nice. Okay. Welcome, everybody. Happy Fire Your Boss Friday conversion chemistry webinar. Marketing agency near you. Franklin Benefits Group, massive crossover event today. This is what they call in the Marvel Cinematic Universe a Nexus level event. What is it called? An anchor being. Mike, you're the anchor being in my
Uh-oh.
multiverse right now. I just want you to know that.
Can I be the Red Hulk instead of the Green Hulk?
Yes, as long as you bust out of that delightful pullover
There we
that you're
go.
wearing there. Yeah, tag that again. What was that company name called?
That was Mercology.
Mercology. Okay, yeah, I'm sure that'll be popping up on all of our feeds now that we mentioned it. I just want to restream this to my personal page now that we're warming up here. Cool. All right. I do want to ask anybody who is watching on conversionchemistry.com/webinar to join us on either YouTube, on Facebook, on LinkedIn, so that way you can comment live. If you're watching on the page itself, you are not able to participate, and that's no bueno. And we also have Missy Jones here too, from marketing agency near you, project manager of my company.
Hey, Missy.
Good morning.
All right. So we have a crossover event today. Mr. Braun here from Franklin Benefits Group is going to be giving us a presentation called Maximizing Benefits, Minimizing Costs, Health Insurance Strategies that every entrepreneur and really every business owner should know. Mike is the owner and founder of Franklin Benefits Group, the premier health insurance broker in Jamison, Doylestown, Bucks County. And that's not all, Mike. You're licensed in a few states. Correct me if I'm wrong here.
I am. New York, Pennsylvania, New Jersey, Delaware, Florida, South Carolina, Texas, and maybe some other states too that I don't know about. But I've been licensed in probably about 14 states over my
Wow.
career.
Is that all?
That's all.
Well, that's good. And I do apologize for Conversion Chemistry International viewers. I don't believe Mike is able to help you just yet, but we don't want to put any self-limiting beliefs that someday he won't be an international global presence. All right. So, Mike, I'm going to add your presentation to the stage here, and then you'll be able to take it away. And this is really good stuff because I know as, a small business myself, really my journey was going from, employee to freelancer to, I guess, entrepreneur. Entrepreneur kind of encompasses more of a mindset and a way of doing things, to a small business owner and operator. And, health insurance isn't, it's not a shiny thing that we want to, really think about, but when you need it, you need it. And especially when you are at that stage of being a key person in a business, you cannot, well, I mean, if you get sick, you get sick, but you want ways to navigate around that. And, Mike's going to take us through that here today. Hey, there we go.
There you go. Thanks, Dan. Appreciate it.
Mm-hmm.
So I'm just going to start off and say, based on what Dan said, sometimes as business owners, there's an expression: doctors make the worst patients, and lawyers make the worst clients, and entrepreneurs make their own, make their worst own, decisions sometimes because you're so busy trying to run and operate a business that you forget about yourself or your family, and that's not a good thing. And you need to make sure that you're paying attention to those details, because you don't want to have a setback. You have those setbacks, and that's what will push your business under. Most of the time people talk about medical bankruptcy, and medical bankruptcy is, one part of the equation. But a lot of times what happens is, if you have a medical problem, a lot of times it limits your ability to earn money. And that's an entrepreneur or solopreneur. Those things also, have a effect on the business, trying to grow it, and then obviously trying to scale your business. So we're going to talk about ways that you can kind of limit your exposure, limit your risk. And these are some of the things that, over my career I've kind of come up with. And I figured we put it in a presentation and deliver it to people that were in their own business, developing a small business, or even have a business that maybe has 25 or 30 employees. So let me give you a little bit about details about me. I lived in Doylestown for about 25 years. I'm a graduate of Temple. I went to the School of Risk Management and Insurance. And everybody's like, "You're crazy. Why would you want to do that to yourself?" But Temple has one of the premier programs in the nation for risk management, and it really fit well in with a marketing major. The one element that people don't realize is that a lot of the Penn professors also teach at Temple, so you get a Penn education for Temple dollars. So that's also
Okay.
nice.
That's a key
Um,
takeaway.
so so I also worked for carriers like Aetna. I cut my teeth when it was actually U.S. Healthcare, but nobody really remembers U.S. Healthcare. We used to do all the presentations, and we used to deliver the apples. My car used to smell like an apple all the time because I had a case full of apples in the trunk at all times, just ready for open enrollment meetings or any type of other carrier events that we would do in the community. I also worked for a short stint for United Healthcare, worked for a company that got acquired by United Healthcare. Um, I've been an agency owner for the last 15 years. I'm a member of NABIP, and it's a National Association of Benefits Insurance Professionals. And then I've been a 10-year BNI member of the local BNI chapter. So that's a little bit about me. I'm married and I have one kid. I went dirt biking this weekend and I hurt my ribs, which was also a lot of fun. And then somebody's going to ask me, well, did you go to the doctor? No, I'm a man, so I'm not going to go to the doctor. We don't go until we fall over. But anyways, yeah. So that's a little bit about me. So I don't know whether or not people can see this. So here's a little insurance funny. Your insurance is refusing to cover your, machine. So we're going to switch you to another machine, and you can see there's a so-so life support they're going to switch you to. Now, it's funny, but people do think like this. They think that, based on your insurance, the doctor's going to look at your chart and determine what course of treatment you're going to get, and that's certainly not the case. Um, they look at your chart to see what your vitals are and see what how they can treat you. Um, that's not the case. They're not going to give you inferior care. Now, I will say, based on the insurance, it depends on what kind of care you'll get, meaning for future treatments. But that's a different discussion. So today we're going to give an overview of insurance for entrepreneurs and the importance of having coverage and then navigating costs and benefits and what works well in the community in the Philadelphia and New Jersey marketplace. It's mainly probably our audience. If people have other markets, I can probably talk a little bit about it just because I've been in the insurance business for that long. So we'll kind of give you an idea of what you can do in your marketplace and maybe direct you to somebody that might be able to help. So why is insurance essential? So I always say insurance is, it's a form of risk transfer. You pay a premium and it basically transfers your risk, whether it's health insurance or car insurance or homeowners insurance. Um, people have to understand that you don't really want to use the insurance, but you want to have it just in case you need it.
Better to have it and not need it than need it and not have it. Just like a
Exactly.
good line of credit. Yeah.
You want to have, you want to have fire insurance for your house. You want to have health insurance for your own house, essentially, you and your family. Gives you access to preventive care. Obviously, that's one of the things that people don't do as much as we would like them to do, is access to preventive care elements, mammographies, wellness checks, blood pressure, blood sugar checks. Those are key vitals. Those are all essentially what we call preventive care items. One of the misnomers is that, when you have preventive care, once you're in a course of treatment, considered in course of treatment. You're not considered preventive care anymore. And then obviously sometimes people say, well, compliance and legal requirements are always like a stumbling block. It's complicated. I got to talk to my tax accountant. Well, if you talk to a professional like me, we try to make it easy. We work with CPAs. They ask me questions all the time, and I go back and forth with them. And then the last thing is we want to enhance the business stability. and your personal well-being. That way you're productive. We feel that if you're productive, you'll make better business decisions, and you'll have a better business as a result of it because you are being more productive. And then the other element to it is that if you have employees, it also gives them financial stability as well. There's a term called, your overall financial wellness, and health insurance is just one component to it. Then you have 401k and IRAs and stuff like that. But you want to make sure your employees also have a good financial wellness because you don't want to have them to be stressed out, making decisions for your business.
And it's a benefit you offer to an employee anyway.
Ooh, sorry, getting ahead of myself here. I don't know why this screen didn't come up. So what are the options for entrepreneurs? So one of them are individual options, penny. So we're going to talk a little bit about the penny because that's Pennsylvania exchange. Get covered is also, part of New Jersey's exchange. And then you also have the healthcare exchange. I guess about 5 years ago, Pennsylvania took away or took it from the federal government. It used to be called the healthcare exchange. But about 5 years ago, they renamed it called the penny. It's actually a better system for agents and brokers and the consumer because Pennsylvania does control more of it. And also, as a result, premiums went down because you were essentially paying a premium tax to have access to the national platform. Then in the Green Square, there's what we call group plans. You can have a group plan. You can start with 2 employees. You can go all the way up to 250, 500, just, depending on what type of group you have. There's ICRAs that we'll talk about. And, the other component is that, give me one second, I just want to make sure. So on the group plans, there's what we call fully insured and also group plans or level funded plans, which have grown over the years. Level funded to an employee walks and talks like a fully insured program. There's a little bit more legal problem, but that's why you come to somebody like me who helps implement those, educate your employees, and also help you with the compliance end of, all those types of programs. In the blue square, there should be association health plans. Association health plans are, people keep talking about them. I'm not a huge fan of the association health plans. Everybody says, well, if you can pool your risk, you can lower your health insurance costs. It's essentially true, but like, for instance, like I know for instance, just Blue Cross 2 to 50 business segment, that small business segment of Blue Cross and Blue Shield, there's already over 1 million people in that insurance pool. And there's not many places where you're going to get over 1 million people in one insurance pool. So you have to remember that the insurance company is going to pool that risk, and they're going to try to, squeeze the savings and yield it to the consumer. And then in the purple, there's MetaShare, which we'll talk about. I'm not a huge fan of the MetaShare because you don't pay premiums, and it's not essentially risk transfer. There's a lot of other elements that are missing from that. And then the green square in the top left is Medicare, because there are some entrepreneurs that, maybe have a second career or, even a third career, and they start their own business, at 65 once they retire, maybe from, the police force, or maybe they have somewhere where they work for a pension for a while. Maybe they want to do handyman work, whatever it might be. So we'll talk a little bit about that as well.
And that changes the typical trajectory of, okay, I'm turning 65, Medicare, end of story. Because now you got people who are, maybe, like you said, they got pensions, but also they want to keep going. And even if it's a passion project that has some form of monetization, we work with a few of them in conversion chemistry, of course. There's better options than just, okay, retire Medicare. It goes deeper than that.
There's people that always want to give back, even if it's, maybe they're setting up some type of mentoring business program or coaching program where they want to coach young entrepreneurs. But they're 65. They still feel like they can give back to the
Mhm.
community. So, um, and I find it enlightening. Also, too, I find that a lot of the people want to keep going. They want to keep working. I call it grinding. Like they still want to grind, and that's fine. I have an 80-year-old that likes sales. He works 20 to 30 hours a week doing sales for a small business, and he loves it. It's not like his be all end all, but he likes the game. He likes negotiating. He likes calling
Mhm.
on new businesses and stuff. Um, so individual options. So like I said, this is either through the exchange. If you're just starting out in business, this is a real good viable option because you can get subsidized coverage for yourself and your family. One of the key takeaways from the exchange or the penny is that you'll never pay more than 10% of your um, earnings for premium. So that means if you make $100,000, you'll never pay more than $10,000 in a year for health insurance. Now, premiums are based on your age. So the older you are, the more expensive it is. Um, and then also too, the subsidy is based off of your household earnings. So if you're just starting out in your business and maybe, you're in the red for a couple of years, you want to try to avoid going on the Medicaid. So Medicaid is roughly, in that 18 to say 27, depending on your family size, 27, $28,000 mark. Reason why I say Medicaid may not be an option for you is because it has a very limited network. So you may not be able to access providers and the care centers that you want to access because of being in Medicaid. So I say, you know, when you're looking at your income, be conservative. You don't want to be super aggressive to pay a lower premium because you will reconcile that premium at the end of the year when you're doing your 1040. I'll give a quick example of a client that I had that was 63. He was retiring too early for Medicare. So him and his wife wanted to go on to the exchange. He planned it to a T. He planned him and his wife at $43,000 a year. And what happened? He had an unexpected loss in the family. His mother passed away and left him $40,000. So now instead of his income on $43,000 with a heavy subsidized premium, now he's at $83,000 and he had to pay back the entire amount of subsidy during that course of that year, that next year when he filed his taxes. So, like I said, just be conservative. I know there's things that are unexpected, but you can always change it, which is also nice too. So you can change it to accommodate that so you don't get a big bill at the end of the tax year.
So is that something that's calculated year after year?
Yeah, so essentially what the penny does is they'll look every year based off of your 1040 tax filing, and they'll determine your subsidy based on the income. And they will question, like, I have clients that get pulled. It seems like they almost get pulled every year, where their income doesn't match what they're putting on the penny application
Mhm.
or get covered. So you just want to try to be accurate as much as possible. It's still a system where it's still based on the honor system, but after a couple of years of trying to maybe get away with a lower income and paying a lower premium, eventually they'll catch up with you.
Okay, so you brought up the issue of something unforeseen happening, a we'll call it a tragic windfall, that led to a substantial change in that premium. But what's a mistake that you've seen that people can prevent that has nothing to do with something unforeseen?
Um, Putting too low of income or not following, I would say the biggest thing is when the penny or get covered, whenever they send you a notification where you need to update information, you need to give them the information because they will take the subsidy away. They won't cancel your coverage; they'll just take your subsidy away.
Okay,
So, and that happens quite often. So, and
and
people are
you don't
quite
want that.
shocked.
You want that. You
Yeah,
want
because
that company. Yeah.
there's a difference between premium and subsidized premium. So,
Mhm.
like for instance, my personal opinion is that I think the premiums on the exchange are very high if you don't get a subsidy. But the fact that 75% of the people that are on the penny get a subsidy means that it's working to some extent. But if your premium is $1,000 for for yourself, and you're subsidized $800 and your premium's only $200, when you get that bill for 1,000, it's kind of a shock
Mm.
because you're paying the full freight of the premium. So the other thing too is that just note that the open enrollment is from 11/1 every year to 1/31. So that's the open enrollment window. You can qualify for qualified life events, marriage, death, divorce, adoption, births, and those kind of give you those special election periods. Also, moving from one area to the next will also trigger a special enrollment or qualified life event. But essentially, once that window closes, you can't get on coverage. What the great part about the exchange is that there is no pre-existing conditions. So the only thing that they can ask you is your age and whether you smoke or not. And some carriers don't really care if you smoke or not. So that's the other thing. So
We're not advocating smoking, but
yeah, Blue Cross and Blue Shield. There's a lawsuit about Blue Cross and Blue Shield's surcharge on smoking right now. Isn't that a little funny? I'm so happy I don't have health insurance, so I get to pay all my medical costs out of pocket. Said no one ever. One of the issues, and I've been in the insurance industry for over 25 years now. One of the things that I think people that I would have liked to have hoped in my career so far is having the employees or having consumers shop much better than they do right now. Nobody knows what anything costs. I was just on a webinar with a carrier yesterday, and they have a product, and in the insurance industry we've been talking about it for years. A simple MRI. What does it cost from one place to another? Well, I'll just give you a quick range. So we put it in Philadelphia area, MRI, knee. That's it. $200 was the lowest cost, and the highest cost was $3,500. That's with insurance. That's with insurance. So insurance, you pay a reduced rate. However, the variance between one place to another was just astronomical. And people would be surprised that if they manage that better, if they were a little more responsible for what they're looking at, they would engage, I think, a little bit more on that topic, because it can impact them quite substantially. Here's some more individual options. We have sole proprietor plans that we also sell that are available all year long. For 1099s, real estate agents, lawyers, that work by themselves, or maybe they're in a practice, but maybe they, have their own separate corporation. These are lower premiums. Some of them are limited benefits to drive down the cost a little bit, or maybe have a scaled down network. So those things, some of them have 10 underwriting questions like, do you have cancer? Do you have AIDS? Those types of things. What prescriptions do you take? Do you have diabetes? That type of stuff. And, like I said, these plans are available to you at any time, which is nice. They're available for the first of the month. There's different network options. Like I got one with a Blue Cross and Blue Shield option. I got another one with a Cigna option. So there's all sorts of network options, and it's important that obviously you get the network important. Then there's short-term plans. You can buy them for 4 months at a time. All these are what we call tax deductible, so that you're paying a premium, so you can obviously deduct them as a group health expense. But the short-term plans are nice because they are they're designed for 4 months out of the year. You reapply after every 4-month period. There's plans that you can actually have just accident, or I should say hospitalization and surgery. There's no primary or specialist component to it. And they're quite affordable. I had somebody that fell out of the exchange. They didn't want to pay a high premium like a private plan. and the hospital and surgery plan was, I think it was $80 per month. Granted, she's 28 years old, but at least it, gives her some type of coverage for herself, going forward. Um, and those are also underwritten too as well. Group plans, they work a little differently. I think the biggest thing when you're deciding this is what's your budget going to be, and what do you want to offer to your employees. If you're a business with 5 employees and you plan on scaling it up to 15 within a couple years, obviously, benefits and your employees are key to your business growth. So you want to make sure that you're putting a plan in place or putting something in place that, one, doesn't break your back, but also gives the employees what they're looking for as well, so they don't job hop on you. Um, I didn't even know this was a thing, but ghosting was a big thing, 4 years ago during the pandemic, where somebody would take a job and then they would leave at lunchtime and have another job. Um, I didn't even know that existed until one of my clients was telling me, I got ghosted. I'm like, well, what's that? I don't understand it. But I think the big thing is knowing your budget and staying it, because one of the key things is when you're getting that insurance bill and you're paying the insurance bill, you're paying the entire amount of premium for you, yourself, and your employees, and that could be a burden to your business, and you don't want to make sure you have cash flow in order to pay for that health insurance premium. You don't want to offer something and then have something go wrong. So you want to make sure that it's okay in your budget. Talk to your accountant, your bookkeeper, as well as maybe a CPA to maybe see if it's appropriate and affordable for your business. The other thing too is that in a group plan, you have to contribute. The minimum standards is 50% of the premium for the employees, or 75% of the single cost. I recommend probably in this area, probably about 75, 80% of the single cost. During the pandemic, I would say, a lot of employers went all the way up to 100% because they wanted to keep and retain their employees
Mhm.
during that period. And then, the other thing you have to keep in mind too, or what are your healthcare needs for your employees?
Right.
Do you have young families, or, are you hiring young females? And maternity might be an issue. So those are some of the things you have to keep in mind for your business. And then obviously payroll deductions, you can do them on a pre-tax or post-tax level. If you do a post-tax, just note that you can be discriminatory. That's one of the key elements that people don't understand. But if you do a pre-tax, once you put what is known as a premium-only plan or Section 125 plan in place, you have to make sure that everything is kind of even on every standard, meaning not so much the owner, but like management versus hourly employee. You have to make
Mhm.
sure that those standards are the same.
And we do it to say we are not accountants, nor are we attorneys. We are not tax specialists, even though this is basically from your experience and our collective experience here. We're talking about this, and we do always suggest you talk to an accountant or tax attorney, in line with making these decisions. Because, like you said, like depending on the size, scale, scope of the business, these can be. I think they're mostly above the line deductions. But again, that depends on your organization and how you claim it.
Yeah,
So
so group healthcare expenses are a deductible expense.
Mhm.
Um,
For the
and then
business. Yeah,
for the
for the
business,
business.
yeah.
Yeah, yeah.
And then, one of the things is what type of plan to implement, and then who is eligible for benefits. Typically, the ACA put a standard out there of 30 hours of is full time,
Mhm.
but you can go 35 if you wanted to. If you're a small business, you can go. I saw a plan yesterday. You can go all the way down to 20 hours
Oh,
if
wow.
you wanted to a
Okay.
week for benefits. So it's really up to the employer. You also can't go past 90 days of benefit waiting period. So if you're a full-time, newly hired employee, you have to offer that employee benefits if you have a plan in place. So you just need to note that.
Yeah.
So plans can be implemented. The nice part about group plans is plans can be implemented at any time. They start the first of the month, but you can do it anytime. There's no time frames that you need to worry about. Underwriting is based off of age. There's no pre-existing condition clauses on group plans, which is also nice. Level funded programs are underwritten, so we take that into account. And basically, if you have $100,000 in premium, and the employees only use 25,000, there's going to be a surplus that's going to be returned to the employer based off of the experience of that group. That's why level funded plans are great. I just had a group that got a $10,000 refund on their plan, and they have about a $75,000 premium. Now, there are still cost factors like stop loss premiums and general admin costs, but generally a $10,000 surplus for a small group was a nice amount of money for the business to get back.
Question. So plans can be implemented at any time for the first of the month. That's good because it's not restricted to open enrollment. But does that mean if an employee starts on the 23rd that they will not get coverage until the first of next month?
So yeah, so if you're putting a plan in place, but that will be based off of your benefit waiting period.
Okay.
So some employers have a first of the month following date of hire, first of the month following 30 days waiting period, first of the month following 60 days waiting period. It all depends on your business. You just need to be consistent. So that's the other thing too.
Okay.
Do for one, do for all. As long as they're in that same class, like full time. Premiums are a group health care expense, and then obviously plan designs like health savings accounts, HRAs. We do some different things. A health savings account is a tax deferred account that essentially lowers your premium but gives you the ability to create a IRA or a medical IRA, and you can actually put money in that IRA every year and it rolls over. I have clients that have $50, $60, $100,000 in their HSA accounts, but you got to remember too that these people aren't going to the doctors. But they are getting preventive care because I asked a couple of them that have nice balances to their account. But essentially, that money is theirs. They can use it when they turn 65, just like an IRA, or continue to use it as a medical, tax-free medical spend account.
Yeah, it's got the side benefit of being an investment tool.
Yes, exactly. So you ever say, you heard for saving for a rainy day? Essentially, the health savings accounts are designed for that. One of the key components of health savings accounts, and this is one of the reasons why I always liked them, was the idea was you start with a lower deductible because the plans are kind of regimented, and you have that low deductible or lower deductible, and then you raise your deductible over the course of time, which will lower your premium. And I find it, that some people do that, some people don't do that. Some people are money in, money out, but there are, maybe about 25% of the public that have put money in their account and they just keep socking it away. So ICRA is a newer form of coverage. I shouldn't say it's a newer form of coverage, but you're like, well, what is it? It sounds like poison ivy or something like that. It's individual coverage health reimbursement arrangement. And essentially what it is it really provides a group plan on an individual chassis. So the employer is not getting a bill for healthcare coverage. They're not going to get a bill from Keystone or Aetna or United, so they're not responsible for that. What's nice about the ICRA is that the employer can set a contribution amount for their employees, and that's really the only thing that they're on the hook for. And then the employee can also payroll deduct their premiums from their payroll account. And then on the back end, from an administrative standpoint, the person that's administering the ICRA will send the premiums in for payment of those insurance premiums. So it's like having a group plan from an employer standpoint, but not from having the bill standpoint. So if you're a younger business or maybe like a newer business, I would say maybe this might be a viable option. I also find that this might be a viable options with like home health care industry or janitorial type fields. We have heavy employee turnover. Fast food restaurants, those types of industries where coverage is hard to find. I'll give you an example of McDonald's. I know a McDonald's franchise owner. They have 20 stores. They have over 1,000 employees, and out of the 1,000 employees, 50 of them were full time. And then when came time to do the plan, I think only 5 people wanted a plan.
Mm.
And you're going to go through all the that whole group side of underwriting. Um, the whole case, where if you did an ICRA, it would have been a lot easier just to administrate because you're only worrying about 5 employees really. And
Is
then
that
as
kind of like a threshold of who should be using this as like 5+ employees or like?
no, not necessarily. You can do it with 2. I'm just
Oh,
giving
okay,
like
interesting.
I was just trying to give you an example of
Mhm.
like 50 people were actually eligible and then 5 actually wanted coverage. So it's
Right.
kind of one of those things. Um, so you never know what people's insurance is until you kind of do a project like this. Um, so because we have some employers that have high heavy turnover, and
Mm.
some of the elements to having an ICRA is a little bit easier. There are rules to it, and if you have a consultation, we can go through the rules, but it's not as restrictive as say a group plan, or I should say not as compliant as a group plan, but not as financially burdensome as a group plan as well. So gives you kind of a duality of it, which makes it kind of a unique presence in the marketplace.
And also, it sounds like in this, for me, it defers the administration away from the business owner completely,
Yes.
or at least for the most part.
hmm Well, what's nice is the employee can choose their own plan.
Right.
It's about choosing a plan. So if you want a bronze plan, choose a bronze plan.
Okay.
And we didn't even get into that today. But, if you want a gold plan, choose a gold plan. Just note that it's going to cost you more money. So,
Right.
and what's nice is that, if the employer is just doing kind of a fixed, defined contribution or a fixed contribution each month, I'm paying $250 per employee that's eligible per month.
Okay.
That's it. So if the premium is $750, I'm only paying $250, and the employee's
Mhm.
paying $500.
Okay.
And you're not worrying about any bills. You're not worrying about what coverage they chose.
Percentages, right, right.
Yeah. So that's why I say some of the flexibility with an ICRA is nice because
Yeah.
you don't have to worry about it. I mean, one of the things is, as business owners, we're paternalistic or maternalistic. We want to take care of our employees. We want to make sure they're happy and healthy. And, sometimes it's a little hard because you can't worry about every employee because, once you get out and you're just like, I don't have time. I have my own problems. So,
Yeah.
so that's why I say ICRA is a nice balance. Association health plans, they're not really that big in Pennsylvania, New Jersey. Those you start to see like with associations or affinity groups, like your chambers and stuff like that.
Mhm.
I don't see them that much. However, you have to be careful because some of them aren't insurance. They're, what I call shades of gray insurance. Like they'll be sold within or marketed as health. Like there are bundled like accident plans with say um, critical illness and stuff, and it will pay your bill, but it's not really insurance. Um, and those can be written at any time, and there's some underwriting required, but usually in an association, there's nothing. We ran an association when I was at US Healthcare. It was a small business chamber that we ran in Bucks County, and it started really good for the first 2 3 years, and then year 4 it was like a tidal wave of claims because what happens is good risk drops out and they find alternative solutions, and bad risk stays. That's one of the things that is so unique to healthcare consumers, is that if you have a plan and you like your plan, you're not going to move because of fear of the unknown, or fear of changing something that would affect your coverage. It's a weird psychological, buying behavior, but for some reason, we used to see it at the carrier level, and it's so true. People on Medicare rarely switch plans. They just really don't. They don't, once they get on a plan, they don't really come off of it. My mom's been on Keystone for 25 years, and it took me.
Okay.
I just I'd slightly tweaked her plan. I changed it, not even from carrier to carrier, but just from one plan to another. And she didn't want to do it for the longest time. She just didn't want to change. So MediShares, these plans are, they're called healthcare sharing. There's no premiums involved. They don't call it premiums. Um, so one of the things that I call these shades of gray, they use terms like they may cover, and usually pre-existing conditions are not covered. So if you have, like, say, diabetes or maybe high blood pressure, sometimes they will not accept you into the risk pool. And the other thing too is, there's no legal obligation to pay medical bills, which I find quite troubling because that's not why you're buying insurance. So I do understand why some people may go into it because they're attracted to the lower cost of it, but you just have to be careful because, like, for instance, when I went down this road of looking at MediShares, they told me that I need to have my own a separate E&O insurance, and I have E&O insurance to cover me for all the stuff that I do and advice that I give on a daily basis. But now all of a sudden I need to have a separate E&O just for MediShares. I just didn't understand that.
Mhm.
I was like, well, why do I need a separate E&O coverage? So the other thing too is that shares, quote unquote shares, are not tax deductible as well. So you have to keep that in mind. Like I said, I'm not a big fan. I've had some, I've heard some success, so I can't shut it down and say they're not good. I just don't really sell. A, I don't sell them, and B, I don't like this term may. I really don't.
Yeah, it's gotta be for a very specific buyer for this one.
Yes. Medicare, this is for the late bloomer entrepreneur. I want to start my own business, and now I'm finally retired. I had a guy that I go to Eagles games with, and he worked for the pharmaceutical industry for, I don't know, 30 years. And he's a little older than I am, but he's still a young guy. He's 58, and he's not eligible for Medicare, so he's going to do some things, that we did for him. But essentially, he's going to start his own business. I mean, that's what he wanted to do,
Mhm.
essentially. But Medicare's for, 65 and older. You need to qualify and work at least 40 quarters or 10 years. You get both Part A and Part B, and their hospitalization, and Part B is the doctors and testing part of the coverage. And your standard Part B premium based on your income is $185 a month. Most people pick up a supplement or Advantage plan, and it's not an expensive plan. Most people say to me that, my costs were cut in thirds once I went to Medicare. So, it is a good program. Obviously, there's a lot of talk about it, but, we give, I give seminars on Medicare and people aging into Medicare and what they need to do. But essentially, if you're working for a large employer and you're over 20 employees, you have, you have the plan, maybe the group plan that's being offered. That is plan primary. If you're under 20 employees, and you're over the age of 65, Medicare is primary, and you will need to pick up Medicare. You can't be on a group plan or an individual ACA style plan.
Mhm.
So that's one component, and that's why you need to know about Medicare. I had a lot of business owners that were aging into Medicare, and all of a sudden, they're asking me all these questions. So then I got more involved with the Medicare program, and the carriers were also enforcing that Medicare primary rule. So And then I'm not going to get into it today, but then there's, penalties if you don't pick up certain components of it, if you're eligible for it and stuff like that. So you just need
Well,
to make
we
sure.
will say, yeah, I mean, you know the ins and outs of this, and it's way more than anyone. Even the presentation you give on this is not enough to, explain the scenario to everybody. So fbgmedicare.com,
Thanks, Dan.
fbgmedicare.com. We got some resources on there, and then you can book a call with Mike.
There you go. Tax benefits of health insurance, self-employed health insurance deduction, it's a standard one. HSA contributions are also considered a healthcare expense. When I was talking about ICRA before, they're also considered a healthcare expense. So the deductions that you make for your employees, they're also considered a group healthcare expense. You may not deduct any premiums, that the employees are paying for health insurance on the penny. So if they're getting a subsidized coverage and you want to kind of give extra money to the employee, you have to make sure that it's in salary and it's in taxable premium and not in the form of, some type of payment for healthcare and treated as a healthcare expense. Employer contributions in a group health plan are also a deductible expense, just so you know that. So there's some tax advantages as well. That's why I say, talk to your tax. Like I have some business owners that have what we call virgin cases, where they're established businesses of some size that never offered coverage before. We just had a large employer offer coverage for the first time, and they did so because of they had tax issues. So it's considered a healthcare expense. So key considerations when you're choosing a plan: monthly premiums versus the out-of-pocket expense, and how much do you use. So whether you're, if you want to choose, say, a silver plan or a bronze plan, because you don't go to the doctor that often, that's important. But if you're running to the doctor 3 or 4 times a month, you may want to choose a gold plan, because it's all about the balance of premium versus your out-of-pocket with the plan that you're picking. Networks that you're using, that's also plays a factor. Sometimes the carrier with lower cost, there's a reason why, and maybe the network is smaller. So you need to make sure that will work for you, because if you want to go to a certain provider, it may be out of network, and you may be paying more out of pocket for that provider. Prescription drug coverage, some coverage out there, you want to make sure the formulary works for you. There's some of the plans that you can be shown that, don't have any prescription drug coverage, and maybe you're on an injectable medication or a specialty pharma. So you need to make sure that, those things are kind of taken care of. And then additional benefits like dental, vision, and disability. I talked about before, about medical bankruptcy and stuff like that. One of the things that, I always talk about with people is that, it's your ability to work and make money. And bankruptcy occurs when you don't have money coming in. So if you can't work because of your health and you don't have money coming in to pay the bills, to pay the insurance premium, it also forces some very bad decisions for yourself over the next couple of years and months.
When you say medical bankruptcy, you mean the actual legal process of bankruptcy?
I'm sorry, what was that again?
Medical bankruptcy.
What do you mean about? Sorry,
Are you referring to the actual legal process of bankruptcy?
Yeah, legal process of bankruptcy. Yeah. Because you always hear the horror stories somebody couldn't pay a $500 bill and it caused their medical bankruptcy.
Mm-hmm.
I mean, I never really understood that. Why you would file for bankruptcy with, I'm not an attorney, but why you would do that. But maybe there are some other various factors that you're filing, and that could be the key component to that medical bankruptcy. I kind of read a little bit into it. I kind of lost my research element to it because I lost interest in it.
Well, it's something we would try to avoid.
Yeah. So how can Franklin Benefits help you? Obviously, I always say this, everybody is different. Everybody's decision is different. Everybody's needs are different. So we'll help you, evaluate you, and guide you. I think that's one of the biggest factors that we can do for a business owner is become that trusted advisor and help you really um, find the right path that makes sense for you. We assist with the enrollment and compliance. So we set up a program for our groups called Ease. But even if you're enrolling on the penny, we'll help them do that for you all. I just helped a person on the exchange. They were retiring next month and they wanted to get coverage for themselves. So we did the application in about 20, 25 minutes. She was very thankful that we did it, and then she'll have Medicare at 65 in a couple of years. We also help on ongoing support and billing questions and claims. One of my staff members is great with claims. She's really good with kind of deciphering it. Just remember, anything with claims is always based on your date of service, not when the bill comes in. We also help with onboarding. We have a whole communication package, and we help the business owner support them and also educate the employees on their benefits. That's one of the things that I try to pride myself on is helping those employers that really, they maybe do HVAC installation and they do, they're a plumber, so they plumb. That's what they want to do. They're not really in the business of administering benefits, and that's what I do, quite frankly. What was the last point there, Dan?
Oh, I removed you prematurely,
Yeah.
didn't I?
Yeah, sorry, man. And then obviously we're experts in whether or not it makes sense for fully insured or level funding. We've had some clients that just, quite frankly, they should have been on level funded, and we took them from a level funding platform that they're currently on and moved them back over to a fully insured program because of the claims issues that they were having. And then also too, we help with plan compliance, whether Section 125 COBRA, ICRA administration. Just note that the ICRA form, the individual coverage form for a group, you still need an administrator to help you administer it, but you're not receiving a bill on it. So we can help with all those requirements. And then if you have any questions, my number's up here, as well as my information, my email address, and then obviously the small group blueprint or benefits blueprint will help and guide you with compliance issues and any type of questions that you may have. It's just kind of something we put together, and you can read it for more information. Yeah, there it is.
It's a lot of good stuff there, and it's kind of a catch-all for anybody at any size. I mean, it goes over, benefits optimization, administration, what plans, how to reduce costs, how to, minimize your tax liabilities, all sorts of stuff like that. End of the day, it's a good idea. It's a good thing to pique your curiosity. So go grab it. But then, here's where I'm at. I went from freelancer to solopreneur to small business owner, and these, my insurance needs change as that happens. Right now, the size of my business is, everybody is a 1099, except for me. Well, actually, technically I am, but whatever. That's aside. So my insurance needs will change a year from today, when the top people in my organization will possibly become employees, right? Like actual W-2 employees. In which case, am I going to read through all this? Probably not. I'm going to be like, Mike, help. And then we're going to talk, and then I'm going to shift my strategy and what plan I purchase, either for myself or for the employees. That's the reality of it. That's the reality of it, is like, for myself, and I know a lot of entrepreneurs, they like knowing a lot of stuff about a lot of stuff, but I'm going to the expert for the next level of advice, and that's Mike.
Yeah, I subject to myself to the painful side of insurance work. So I have a tough time sleeping, so I open these books and I read them at night. No, but just to go into like there's an employer's guide to HSAs, FSAs, and HRAs. One of the things that like business owners will say, well, let's put an FSA in, and they say, oh, well, I want to participate in the FSA. We can't because they're a business owner. Business owners have problems with certain types of tax deferred accounts. The
Mhm.
only one that really works in their favor is HSAs, and I always tell
Okay.
business owners that's probably one of the greatest things that if you have, you know, um, if you're not really constantly reaching in your pocket for healthcare, and you're relatively healthy, you're missing a tax deductible, wealth creation tool, because it's a great vehicle for that. But yeah, I mean, there's lots of things in here that people can access and ask questions about. But I'm always available for a consultation. You want to pick my brain or ask a question. Um, One of the things too is I always help people prior to the ACA. You always heard the expression, well, what did people do with pre-existing conditions? So in Pennsylvania, we did have a robust insurance marketplace. The only thing was, it's pre-existing condition clauses. There was only one carrier, and it was expensive, and brokers weren't compensated. But we would help and enroll people in that product, just because I felt that it was necessary, to help them, get to that um, person or entity that they were looking to get for themselves or protecting their family. Like I said, it was expensive, so a lot of people
Mhm.
didn't go in it. The only people that really went into it were people that needed coverage. Then, and the insurance premium was cheaper than paying for the coverage. Paying cash for healthcare expenses. So the funny thing is that coverage was actually cheaper than some of the stuff that you see on the exchange.
How about that?
Yeah. So I mean, the other thing too is that so when you talk about entrepreneurs, so like for instance, I had an attorney that obviously wasn't going to get subsidized. Um, he said to me, he's like, my premium, and he had an HSA. He's like, my premium, because he was 63, my premium was more than my mortgage payment. And I
Wow.
find that, to me, I find that problematic. But before, I would say, prior to the ACA, I could find him and his wife coverage for probably $800-900, but ACA was up to $2,300-2,400. You don't want pre-existing condition clauses, and that's why essentially you're paying for that element or that
Yeah.
benefit. So people don't understand. I mean, like, you could spend 2 days in a hospital and it'll cost you, $30,000 or $40,000, and if you have surgery, that's another 30 or 40,000. So right there, you're at $75,000, for a couple of days in a hospital.
Absolutely staggering.
Yeah, truly is. Um, but yeah, I mean, we're not going to solve the world's problems. That's why you buy insurance.
Yeah. Yeah. Look, it's you got to take care of yourself and take care of your people. That's the best way you can serve yourself and your clients, really.
Yeah, and I hope the presentation was beneficial to everybody. So I hope that somebody learned something from the presentation today. And like I said, if you have questions, let me know.
Yeah, yeah, you can still comment below. I know on Facebook, videos are now being held for 30 days, I believe. We'll keep it on YouTube Live for about 30 days, and then it's going behind our paywall at Conversion Chemistry for our member section. But I know Mike is now an expert at using one of my favorite tools, Opus Clip. So he'll be posting snippets of this for probably in perpetuity.
Yes, probably from now till at least July.
Yeah. Plenty of content there for it. Well, Mike, thank you again. I love your consultative way about doing marketing and selling rather than just being a brute force salesperson. People are tired of being pitched to, so being an available resource it's a key differentiator, and I know more and more people are valuing that. And then in turn, you sell, of
Yeah,
course.
nobody wants to be felt like they're compelled to buy something that you don't need or want.
Yeah,
I want people to, think that they're buying something that they need and they'll get a benefit from. So,
that is the value add way. Well, thank you everybody for joining. We'll see you on the other side. And we have our next mastermind on April 8th, Tuesday, April 8th, 12 p.m. Eastern Time, conversionchemistry.com/webinar. Join us. Thank you.
thanks, Dan. Thank you, everybody.
And ending. Okay.